Welcome to our video presentation. Through Data+, Mason and I have been working on an alcohol epidemiology project. Working with the North Carolina Department of Health and Human Services, more specifically the Injury and Violence Prevention Branch, we worked to revamp and publish a new alcohol dashboard that clearly conveys the impacts of alcohol to a general audience. We also performed data analyses on new alcohol data to discover recent trends in alcohol misuse. In the previous dashboard, there were two main problems. We realized that our new dashboard has the ability to address these problems and the potential to become a key player in the creation of new alcohol policies. Our dashboard was designed through the process of wireframing. The pictures below show the wireframing approach, where we first took a look at the previous dashboard and identified the flaws, then sketched out the base idea of our new dashboard, and finally put in the content and finalized the code for our dashboard.
When making our dashboard, there were three main central messages that we really wanted to emphasize. The first being that the most effective way to control alcohol consumption is through state control or through ABC stores, and also the 4 Ps of alcohol consumption: place, price, product, and promotion. We also wanted to emphasize the idea that consumption affects different communities in different ways and show the alcohol paradox, or the idea that communities of lower socioeconomic status are drinking less but are being more affected more by the alcohol consumption. We also wanted to show that any alcohol consumption comes with risk and that even moderate consumption is not safe. And to move more into our analysis, we first identified the indicators that we wanted to use based on availability. Indicators are alcohol metrics ranging from alcohol outlet density to death indicators, including cost of excessive alcohol use. We then did an elbow plot in PCA to determine that 3 clusters would be optimal for our corresponding K-means test. We performed the K-means test and created a heat map and summary table to display our findings. As you can see in the top right, our rural counties are in red, our semi-urban counties are in blue, and then our urban counties are in green. We also have major cities in the form of black dots and universities marked in yellow stars. This helps us get a sense of the atmosphere in each county. Our radar chart displays the measures of different metrics that we chose to include for each county. We found that alcohol metrics vary greatly by rural and urban states. The variation is large between some counties, and metrics such as death data and ED visits do not follow the same pattern. This table we included shows the difference in ED visits due to alcohol intoxication and death due to alcohol, something that we found very interesting. The chart also shows the percentage of off-premise outlets, such as liquor stores and grocery stores, and the percentage of on-premise outlets, such as bars and restaurants, anywhere where you're consuming at the place. We also chose to include population to give a sense of size for each county. And then the implications of our findings and our work is that we created an updated interactive dashboard, which will display clear narratives for policymakers. And then we also wanted to spread accurate information about alcohol-related harms, which we did effectively. Our clustering helped us categorize the counties, which will help with resource allocation and potential legislation, and then also give more generalized information about which groups are impacted the most by alcohol consumption.